My name is Ashley, and I will be talking about medical ethics. Medical ethics are guidelines in the medical field that prioritize patients' rights and decisions. A major issue within medical ethics is deciding whether a treatment or situation is just. Medical decisions are based on conflicts, principles, and forms of consent, which impacts healthcare's practices and moral responsibilities. Conflicts in medical ethics influences physicians to make challenging decisions based on the patients. Some doctors believe that they should have the right to help terminally ill patients who want to pass on peacefully. This hinders moral this hinders moral responsibilities as well as the Hippocratic Oath. The Hippocratic Oath is to ensure that physicians are to always act in the best way for their patients. Doctors deciding who will get treated depending on the amount of supplies also hinders moral responsibilities. The principles of medical ethics ensures that patients receive ethical care. The syphilis study implies that there was a lack of compassion, which is a moral obligation to encourage the well-being of patients, and kindness, where physicians are to do no harm to the patients. Informed as well as a surrogate consent helps with educating patients of their rights and decision-making for their loved one's care. In an event of a child or an incapable adult, a surrogate, like a family member or friend, would be implied to give consent for the patient. And an example of this is Terry Shavo. She was in a vegetable state, and her husband was her surrogate, prompting him to make all the decisions for her. He chose to refuse treatment while her mom wanted her to live. Informed consent also gives parents the right to refuse treatment for their child that could be vital to the health of their child. These create dilemmas that hinder the efficiency of care provided. Medical ethics is a continuous issue, and with effective communications, such as consent, will improve the outcome of patients.